Okay, guys, I have B for you. The Centers for Medicare Medicaid Services, CMS, has proposed a sweeping 1.13 billion cut to Medicare home health care payments for 2026, a 6.4 reduction that could reverberate across the nation's aging and disabled populations. This move this move comes at a time when demand for in-home care is surging, particularly among older adults managing chronic conditions and those in rural underserved areas where home health is often the only accessible form of care. What's in the proposed cuts? The proposed reduction is multifaceted, combining both forward looking adjustments and retroactive clawbacks. 3.2% market basket update, a downward revision of the inflation base payment update reflecting CMS's projection of low input costs, 8% productivity adjustment, a significant cut based on the assumed efficiency gains, which many providers argue are unrealistic given workforce shortages and rising operational costs. %1 permanent rate reduction, a structural change aimed at preventing future overpayments under the patient-driven grouping model, or PDGM. 5% temporary cut, a recruitment mechanism to recover what CMS deems as past payments since PDGM's implementation in 2020. Combined, these changes could destabilize home health agencies, especially smaller or nonprofit providers already operating on thin margins. Patients may face reduced services availability, longer wait times, or be forced into more expensive institutional care settings. Meanwhile, fraud schemes drain Medicare. Ironically, these cuts arrive as Medicare continues to hemorrhage billions due to fraud, particularly in the home health sector. Common schemes include phantom providers, billing for services never rendered, kickback arrangements between agencies and physicians. upcoding patient conditions to inflate reimbursements, recruiting patients who don't qualify for home health services. In 2023 alone, the Department of Justice charged over 100 individuals in a nationwide crackdown on health care fraud, with home health fraud representing a significant portion. Yet critics argue that CMS's response, broad payment cuts, punishes legitimate providers and vulnerable patients rather than targeting bad actors. Policy implications. The proposed cuts raise urgent questions about equity, access, and the future of aging in place. Rural and underserved communities. These areas often lack hospitals or skilled nursing facilities, making home health a lifeline. Cuts could exacerbate existing healthcare discrepancies or disparities. Caregiver burden. As formal services shrink, unpaid family caregivers, often women, may be forced to fill the gap, risking burnout and financial strain. Workforce impact. Home health aides and nurses already underpaid and overworked may face layoffs or wage uh, stagnation, further straining the sector. Bipartisan concern. Lawmakers across the aisle have urged CMS to reconsider, emphasizing the need for targeted anti-fraud strategies rather than blunt fiscal instruments. What's next? CMS is currently reviewing public comments on the proposed rule, with a final decision expected by the end of the year. Advocacy groups, including the National Association for Home Care and Hospice, are mobilizing to push back, calling for enhanced fraud detection tools using data analysis, stronger oversight for new providers, and high-risk billing patterns, incentives for qualified care rather than volume-based reimbursements. Given your deep expertise in culturally responsive frameworks and community-based interventions, this moment presents powerful opportunity. Would you like to co-create or co-design myth-busting brief or policy response toolkits that highlights the human cost of these cuts, especially for rural, elder, Black, and Brown communities, or caregivers navigating complex systems? We could also map out a participatory strategy to alleviate, um, elevate community voices in a CMS decision-making process. Okay, guys, so that is B for you. Um, I will see everybody Monday for shows. Until then, Gator Wellness. Take care, folks.